Welcome, everybody. I hope everyone is doing well today. Let me make sure all of our things are up live, ready to go. My name is Aiden with California Working Families Party. If you are joining us for the first time, whether on Instagram or YouTube, we are multi-streaming at the same time right now. So very shout out to everyone who is joining us. I know folks are interested and have been interested in having us talk about this for quite some time now. So really looking forward to covering this. We have two fantastic speakers joining us this evening, one with a presentation and another talking about how this really affects our communities across the state. Again, shout out to everybody who is helping out with this production this evening. It is a big thing. Hopefully everyone is able to hear things as they go along. If anything shows up, please let us know in the chat. Chat commands are here on the for YouTube. So if there's anything that you're looking forward to hearing from us or talking to us about, feel free to check out anything that we have posted there. But before we get into the bulk of this evening, I do kind of want to highlight some important things for us all. And this being that I really want us to focus on what it is that we can actually take away from a space like this. An important thing is this is a space for all of us. Not everyone is familiar with who we are. Some folks have been here for a long time. If this is something that you are new to, I welcome you to say hi in the chat wherever you are, on Instagram or YouTube. I would also say make sure what happens here stays here and what is learned here lives here. If you have interactions with folks, that is always fantastic, but please make sure that you are respectful with one another and you take away the knowledge that you have learned here moving forward to all the other interactions you have. The last but not least is when you speak from your own experience, please use I statements. Thank you. It's really important when you're talking about things. Frame things like, oh, I think X, Y, and Z, or I feel yada, yada. You want to make sure that you are being cognizant that you are sharing your own experience that may not be applicable to everybody. So it is really important for everyone to, like, when they're talking about things, whether with addressing us or in the chat, please use I statements. Hopefully everyone is able to hear things easily. I know there might be some audio stuff throughout the evening, so please be sure to let us know if you're running into any audio issues whatsoever. But without further ado, I would like to introduce one of our first speakers of the evening, Yvette Flores, who is a community organizer with the California Nurses Association, to talk about AB 2200, also known as CalCare.
Nice. Thank you so much, Aiden, for that introduction. Hi, everyone. My name is Yvette Flores. My pronouns are she, hers, and today I'm calling in from Ohlone Land, otherwise known as Hayward, California. I am so excited to be here with y'all tonight and talk a little bit about CalCare and answer some of your questions. So I do have some slides that I'm going to be sharing with y'all, which I'll share now. So the first thing that we're going to be covering today is talking a little bit about what's wrong with our profit-driven healthcare system. Next, we will share in detail about CalCare and how it would specifically address some of those same issues. And finally, we'll give you a brief overview of the campaign to win CalCare and highlight some action items you can take to get involved in the campaign. With that said, let's go ahead and jump into the first part of our presentation. So before we talk about what CalCare is and what it would do, it is important to understand some of the key issues within our current system. So let's talk about exactly what is wrong with our healthcare system. Almost everyone either has direct experience or knows someone who has had issues with our healthcare system at one point or another. These issues reveal major flaws in the very structure of the system and can be broken down into 7 areas. The first is lack of access to necessary care, then fragmentation, skimpy benefits, no freedom, cost barriers at every turn, the few come before the many, and providers and patients are pit against each other. So let's take a little bit of a deeper dive into each of these issues. The first problem is that not everyone is able to get the healthcare they need. The ability to get the healthcare one needs is often determined by how wealthy you are. In our state, 3.2 million Californians, almost 8% of the state, are uninsured, meaning that they would have to pay out of pocket for any care they get, something that most people can't afford to do. So to start, our system is not universal. Not everyone has healthcare. Even after the planned Medi-Cal expansion to undocumented Californians takes full effect, we are still predicted to have a whopping 2.57 million Californians who are uninsured. A 2022 healthcare study found half of Californians questioned say that they or a family member skipped healthcare in the past year due to cost. Many reported by skipping care, their conditions got worse. The second problem is that our healthcare system is absurdly confusing. If you are able to choose your plan, which not everyone can do, you'll often see terms like PPO or HMO, plans with different copays, deductibles, and monthly premiums. If you get your health insurance through Covered California, then you also have to pick between bronze, silver, or gold tier plans and the various options within those tiers. You're not alone if you've ever felt confusion trying to navigate it at all. It is a very confusing system. Even Medicare, as it exists now, can get complicated. You either have different parts, so Part A for hospitals, Part B for doctor's visits, and Part D for prescription drugs. Each of those parts doesn't cover the full cost of care. So then some opt for privatized Medicare Advantage plans that replace some or all of the other parts. Many of these complexities are due to the fact that Medicare is trying to accommodate the profit imperative within our existing system. As we'll discuss a little later, a key design feature of CalCare is that they would simplify the system. The third problem in the US is that healthcare plans tend to omit critical health benefits. For example, most plans won't pay for dental or vision care or hearing aids without a supplemental plan. They also often don't pay for long-term care, which is going to become more and more of a problem as more seniors require it and as more people who have to reckon with the symptoms of long COVID need it. There can be substantial variability across plans in terms of what benefits are covered or how much of them are covered as well. Finally, even when a benefit is covered, insurance companies can act as gatekeepers by deeming that a procedure is unnecessary. So despite the fact that insurance companies have nothing to do with the actual assessment or providing of care, even if your doctor tells an insurance company that a procedure or medication is medically necessary for you, the insurance company can still decline to cover it. Insurance companies are middlemen who have a direct financial incentive to deny care, and they do it all the time. The fourth problem is lack of freedom. Typically, health insurance plans will only cover certain doctors and hospitals in a given area. In order to get your care covered, you must go to one of those doctors or hospitals. Otherwise, if you go to an out-of-network doctor or hospital, you'll have to pay for most, if not all, of the cost yourself. And sometimes it's difficult or impossible to avoid going out-of-network. So we've all heard of those horror stories of people getting hit with huge surprise bills. Needless to say, we have no true freedom under our current system. Decisions such as where you get care and what care you get are determined not by you and your provider, but by your insurance company. In addition, at least 12 million people in California grapple with a phenomenon known as underinsurance, which means that they have health insurance, but they can't afford to actually use it to get care because the copays, deductibles, and other costs are too high. As many as a third of all insured people in the US report delaying or skipping a doctor's visit or necessary care because of costs. So we know that it's not just an issue of insurance versus non-insurance. It's also about the copays, deductibles, and additional payments that people have to pay. And lastly, health insurance companies consistently report billions in profits every year, and they do this by rejecting medical claims and denying care while taking money in the form of premiums, copays, and deductibles. In a profit-driven healthcare system, the number one goal isn't actually to deliver healthcare. The number one goal is to maximize profits. The profit motive gives hospitals an incentive to save money that could be pocketed by executives and stockholders by cutting corners on safety and overcharging for procedures that are performed in other countries for half the cost. By cutting corners on safety, these hospitals create unsafe conditions for patients, nurses, and other healthcare workers. This model of a healthcare delivery system has produced a combined $41 billion in profit for the 6 largest health insurers in the US in just 2022 alone. A few years ago, while the COVID-19 pandemic was destroying so much of our economy, health insurance companies and their top executives increased their profits sharply, and that trend is only continuing. As a country, we spend twice as much per capita on healthcare as most other industrialized countries in the world, countries which guarantee healthcare to their people. Not only do we have the most expensive system in the world, but it's getting even more expensive. Premiums, deductibles, and copays continue to make care too expensive, even for people with insurance. And these higher costs are completely avoidable. Then you have the cost of prescription drugs, where pharmaceutical corporations regularly hike the cost of drugs by astronomical percentages, and we have little recourse because we need those medications. As Carmen Comsty, our lead regulatory policy specialist at California Nurses Association, states, providing healthcare should be based on human need, not distorted and profit-driven economic incentives. And that is why the California Nurses Association believes CalCare is the solution to many of the issues we share tonight. First, the legislation would guarantee universal coverage to all Californians as a human right. The 3.2 million Californians that are currently uninsured would be covered with the same series of comprehensive benefits as everyone else in the state. This includes the undocumented, the unemployed, and those who otherwise have a hard time affording healthcare now. Everybody in, nobody out. Second, it would implement a single public program, CalCare, that would pay for all medically necessary care for California residents. In other words, a single payer for healthcare costs in our state. This would eliminate much of the bloat and inefficiencies that plague our current system. By not allowing private insurance companies to compete with a single payer, you can streamline the system and save billions every year in costs that can instead be spent on actually providing care. Third, the benefits package included in CalCare is truly comprehensive. So unlike most current plans, dental, vision, hearing aids, and long-term care would all be fully covered by CalCare as part of a single comprehensive benefits plan. Fourth, when it comes to receiving care under CalCare, people will be free to choose the doctor and hospital of their choice with no narrow networks. Fifth, under CalCare, care will be free at the point of service. So there would be no cost sharing. There are no copays, no deductibles, no premiums. When you need treatment, you go to your provider, you get the care that you need, and it's that simple. This will remove many barriers to care that exist under the current system and will eliminate underinsurance in California. Six, the transition to CalCare means that the end of the private health insurance industry as we know it in California, and we certainly won't miss the current private health insurance industry that we have, but we do want to ensure that this transition is a just transition for the workers who may be displaced or otherwise affected by this change. And finally, CalCare would mean that patient care is based on patient need, as opposed to industry practice of letting the profit motive determine care. So CalCare will eliminate for-profit insurance companies from controlling our healthcare system and will also remove the incentives to provide less care by changing how we pay doctors and transitioning to a new system that is fair and puts patient care at the center. So we are excited to announce CalCare was introduced this year by Assembly Member Ash Kalra. The bill is called AB 2200. And this bill contains many new exciting additions since AB 1400. So some of those changes include an Office of Health Equity that helps ensure that all aspects of the CalCare program promote health equity across race, ethnicity, national origin, primary language use, immigration status, and other population-based characteristics. We also have stronger reproductive health language. We also have language which allocates a portion of the CalCare budget for the first 5 years to healthcare workforce recruitment. And we also have new ways of supporting vulnerable populations to access healthcare by establishing a special projects budget to fund the construction, renovation, or staffing of healthcare facilities in rural or underserved communities. And also prioritizes the funding of special projects that addresses any type of health inequities that pervade our healthcare system, and also details a more extensive transition plan. So with that said, let's talk a little bit about the timeline to pass CalCare. So in about a week, AB 2200 will meet its first hurdle in the Assembly. The Assembly Health Committee will hear AB 2200 on April 23rd. Once CalCare passes the health committee, we will have to pass the fiscal committee by May 17th. Then we will be headed to a floor vote, which will happen between May 20th and 24th. As you can see, there's a lot of very important dates coming up very quickly, which means that this is a great time to get plugged into the campaign. So let's quickly go over the campaign plan together. So over the past year and a half, we've been working hard to increase awareness and excitement for CalCare. We've launched a canvassing program, which included both crowd and door-to-door canvassing. We had a very large weekend of action at the end of March 2023, where we talked to hundreds of people and brought them into our movement. We've been doing outreach to central labor councils and individual unions about CalCare, talking about how CalCare will help union members and their families, and answering questions from rank and file members. And we've launched a robust campaign to build organizational support for CalCare. We've had over 160 different organizations across the state endorse the campaign, leading us to launch a CalCare organizing table to unite some of these organizations to build a stronger field program to pass CalCare. And finally, we've also worked on an inoculation campaign to educate the public about CalCare ahead of the disinformation campaign from the industry that we know is coming. Something that's really amazing and that we're definitely celebrating is the fact that the California Working Families Party has joined our CalCare coalition. So here is a little graphic with some of the other folks that are a part of our coalition, not all of them. But ways that you can plug in and grow this coalition there's several ways that you can join. So the first is we encourage you to sign our CalCare petition, which is linked at the top of our link tree. The second is if you're a member of an organization or a labor union that you believe might be willing to endorse CalCare, have them fill out our organizational endorsement form. This will let us know to connect with them about legislative and campaign updates, as well as calls to actions specifically for organizations. In addition, if you're interested in joining the campaign in an active role, I encourage you to sign up as a CalCare district leader. We host monthly Zoom calls for district leaders who are CalCare supporters who have stepped up to take a little extra responsibility in each assembly district. And we also want to mention that we have a link tree that has all the links to everything related to CalCare. It ranges from signing the petition to financing to passing a CalCare resolution in your city, and so on and so forth. So you should see all of those links in the chat now. And you should visit our link tree if you have like any additional questions or are looking to read up a little bit more on CalCare. But that is basically all I have for you today. Now I have the honor and the privilege of introducing Sheila Banks with Black Lives Matter. She is a policy advocate for Black Lives Matter California, and she is a critical ally that we have in the fight for CalCare. Over the last year, we have worked with Sheila, and we are so incredibly honored to work with Black Lives Matter California, and we're so honored that she's on the call tonight. So I'll pass it over to you, Sheila.
Hello, y'all. Can y'all hear me okay? Can y'all hear me okay? Great. Okay, sorry. I'm joining y'all from an event, so I do apologize, but this was so important that we be here, so I deeply appreciate it. Sorry. Sorry, y'all. It's a little bit hectic here right now. We just touched ground in DC, so I do apologize. But yes, my name is Sheila Bates. I am the policy coordinator with Black Lives Matter Grassroots, which is the overall organization that houses all official chapters of Black Lives Matter, including Black Lives Matter Los Angeles, which I organize with, and Black Lives Matter California, which I also organize with. So first of all, thank you all for being here, and shout out to CNA for getting us here, as well as Ash Kalra, because it has been a fight and it has been a long struggle. I'd really like to start off with grounding us. So I invite all of us to take a deep collective breath. This is a huge step that we are about to go to the Assembly Health Committee, and we have so much work in front of us. I invite each of you to imagine the world we want to live in and build. Think about how it sounds, feels, tastes, looks, and smells. Imagine a world that centers care. Let that fill your body, Let it resonate in every single cell of your beautiful body. Breathe it in. This is possible. It is the imagining of this world that led Black Lives Matter California to support CalCare. It is the other side of abolition. As we tear down systems of harm, we are simultaneously building up systems of care, CalCare. We know that the data about the health outcomes of Black folks, we know that Black women are 3 to 5 times more likely to die in childbirth. And we know during the postpartum period, while that compared to white women, right, 3 to 5 times more likely than white women. And Black infants are 2 to 3 times more likely to die in their first year of life than white infants. We know the life expectancy of Black people is lower and that these outcomes are seen in almost every measure possible. This is by no fault of our own. It is the fault of a system, and it is not by mistake. It is a system that it's not a system that is broken. It is a system that was designed this way, but it can be fixed. It is a system that was never meant for us, and we know that CalCare is absolutely the solution. We see and know, I'm speaking specifically from the framework of Black folks because, well, we're Black Lives Matter, right? And also we know that when Black folks get free, that everybody gets free. And we know that CalCare and single payer healthcare is exactly the way that we need to get there. CalCare would be transformative for Black families and Black communities in California. I'm also a birth worker, and as a birth worker, a Black woman, we know that the data around the Black maternal mortality rates is heartbreaking. In 2018, 37.3 Black birth givers per 100,000 died in childbirth or within 42 days. And that same year, it was 14.9 of white birth givers. That is more than double. In 2021, that went up across the board. So that was post-pandemic, right? That this went up, increasing to a staggering 68.9 per 100,000 birth givers. That is an increase of almost double. The same trend was seen for white women, increasing from 26.1 to an increase of more than 2 times. The same trend was also seen for Latinx women, increasing from 11.8 to 27.5. This is staggering and demonstrates by itself a need for transformative change like CalCare. And it is just one measure, y'all. Keeping healthcare facilities open, having the ability to get care doesn't mean much if the clinic or hospital near you files for bankruptcy or closes, and we know that is more likely to happen in Black neighborhoods. I'm from Los Angeles, and we see this happening to MLK Hospital on a regular basis. They're constantly fighting just to keep the doors open. Lowering costs for Black, Latinx, and multiracial Californians are more likely to be worried about out-of-pocket costs, having trouble to pay for their medical bills and owing medical debt. No such thing would exist with CalCare. Out-of-pocket expenses would not exist. It would increase access to care to 3.2 million Americans who currently have no health insurance. Even after Medi-Cal is complete, Medi-Cal expansion is complete, there will still be an estimated 2.6 million people with no insurance, and people of color disproportionately are represented in those numbers. This bill literally saves lives, but it also creates jobs. It saves money and it generates revenue. It's honestly just common sense, y'all. We pay more money per capita on healthcare and have nothing to show for it. Most countries with a single payer healthcare system spend less money than we do for a system that literally denies and delays care and kills us in the process. Black Lives Matter California is proud to be a key coalition partner in this fight. This is one of our biggest priorities this year. We have a track record at the Capitol, but it is going to take all of us to make sure that this happens. We need the organizations that any of y'all are with to know and endorse this bill. We are continuing to talk with our own partners, and we want you all to do the same. We need you to contact your representatives in the Senate and Assembly. And I'm speaking specifically as a person from Long Beach, And luckily, Gonzalez has already come on board, but Lowenthal, we are coming for you. We are making sure that you come on, right? And we need all of you to join in these calls and do the calls to action that will pop up over the next few months. It is this work that will move legislators to co-author the bill, to sign the CalCare pledge, and to vote for this bill, alongside strategic partners like CNA and other allies like the Working Families Party across the state, including Healthcare for Us, Black Lives Matter California, will be throwing down on this bill. We will drive calls, emails, and talk to our representatives and go to the Capitol. If you want to follow along with this work, you can tap in when we need you to. We know this is a righteous fight. We know this is a fight for our lives and for our future, for our children and our grandchildren. We stand in a long lineage of Black freedom struggle, and that is included with the Black Panther Party creating clinics for sickle cell anemia, right? And acupuncture to help with addiction, and now to CalCare. It was a fight then, and it's a fight now. But we know that when we fight, we win. So let's do this, y'all.
Thank you so much, Sheila, for all of that. Fantastic. Thank you for all of that again. Everyone, can we get a shout out for Sheila Bates in the chat? I know the folks here can't see it that are on the call, but for those of you on YouTube, again, shout out to Sheila. I've been asking folks in the chat to drop questions throughout this evening. I have a couple of questions that I've seen come up. The first one has to do with mental health. I know it was kind of answered in the chat already, but where do we see CalCare what is CalCare's relationship to mental health? And so I'll give it back to you, Yvette.
Yeah, for sure. That's a great question. Mental health is incredibly important. And everything would be covered under CalCare. So all different types of care, including mental health care, would be included. In addition to that, CalCare has a 9-person board, and that 9-person board would be in charge of running CalCare or running our single payer system. And one of those 9 professionals that sits on that board would be a mental health professional. So there would be great representation for mental health on the board, and that would be beneficial to all people in California that would be covered under the CalCare system.
Great, thank you. And the next question is more along the lines of like, what does the path to victory look like? I'll just kind of read it verbatim here. What does the trajectory look like for this bill to pass successfully? Does it look like there will be a path to passing, or is it the beginning of the struggle? Big question to answer.
Yeah, it's a very big question. I'll try to tackle that. So what CalCare is, or AB 2200, is a policy bill for a single payer healthcare system. We know from various studies that have been done that a single payer healthcare system would be cheaper than the current overcomplicated system we have. But in order to start the process to implement a single payer system here in California, we must first state that we want it. And so that means passing a policy bill, which means going through the Assembly, the Senate, and then the governor's desk, and then starting negotiations with the federal government to consolidate our healthcare spending. And so that means that we would have negotiations with the federal government, see how much money we would be able to get in federal waivers, as stated in the ACA's 1332 section on federal waivers. And then we come back home and we figure out the rest of the financing. So when it comes to our CalCare bill, AB 2200, it would not go into effect until it is fully funded, but we know for a fact that it would save money, and we know for a fact that the majority of Democrats, we know for a fact the majority of people that are currently in this overcomplicated healthcare system wants a single payer system. So we believe that there is a movement that is ready to push for a single payer healthcare system. We just need to get it past the finish line. And so that means getting it past the Assembly, getting it past the Senate, and then ultimately to the governor's desk.
Great, thank you. I'm just looking through the questions that people have right now. We have MX Maddie saying that no questions, just complaints, which feels like it'd be common motive to being here. So everyone, um, I think feels pretty on board with this. Another question. I think you mentioned it earlier, but for folks who just joined us, does it cover dental stuff? Seems to be a recurring theme for folks asking about this.
And it totally makes sense that people are wondering what it would cover, because in our current healthcare system, it's just so overcomplicated. There's so many different payers within our current system. We have Medi-Cal, we have Medicaid, we have all covered California, we have private health insurance. But what CalCare aims to do is to simplify the system so that we have one payer, so one single payer in the state of California. And that's what would give us the opportunity to be able to provide coverage to your vision, to your dental. It would give us the opportunity to provide mental health care, long-term care. And that's because we wouldn't have an overcomplicated system that is more concerned with making a profit off of your health care, off of providing your health care, but instead is more concerned with providing health care for you. And so, yes, under CalCare, you would have access also to dental care.
Great, thank you. And then two more really quickly. If trans HRT is included in CalCare, that's one. And then the second one is how many assembly members and state senators currently are supporting or / aligned with AB 2200?
That's a great question. So when it comes to gender affirming care and healthcare, we have a great language in the bill that includes everybody, right? Regardless of any type of background, you're included, and there is an effort being made by the CalCare board to include everybody and to put funds aside to assure that we are including everybody from all different types of backgrounds. For your second question, we have about 20 CalCare co-sponsors from our bill, including we have now people in leadership within the assembly that were previous co-sponsors of AB 1400. So for example, our health committee chair, Mia Bonta, she also was a co-sponsor of AB 1400. So we do have a lot of support over all over California. And it's just about showing that we have that support at events like our committee events that are coming up, and also different canvases and different events that we have throughout the state.
Great, thank you. This is a question I like because it's a simple answer. Is there some way you wouldn't qualify for CalCare?
So everybody's in, nobody is out. Everybody would be covered under CalCare as long as you're a resident of California, which is a great thing. It doesn't matter if you're undocumented. It doesn't matter how old you are, what your background looks like. You would be covered under a CalCare system.
I think that's one of my favorite questions to answer with this. I'm like, you're in. That's all that matters. But thank you. I know folks can ask questions throughout the evening. If there's anything that you have questions about, remember we dropped the link tree in the chat for this. I think I'll just ask one final question. This is what I have. If people on this call, people watching this later on, if someone wants to get involved, what's the one thing whatsoever that they can take away and do after this?
That is a great question. So I think the easiest way to get involved is, of course, to visit the link tree and to take all the steps on the link tree that you feel like you identify with. So first, of course, sign our petition, our CalCare petition. And then if you're a part of any organization that you feel might like to learn a little bit more about CalCare, sign our organizational form. And of course, if you have capacity to do so, join the campaign as a district leader and become a CalCare champion in your assembly district.
Again, thank you so much to our speakers joining us this evening. Fantastic.
Yvette, would you mind sharing with folks, just because I think it's important, could you share with folks about some of the other things that are covered, right? Like I know that things like midwives and doulas are covered, right? And infertility is covered. Can you talk a little bit about some of those things? Because I think that's really important for folks to hear as well.
Yeah, for sure. So when it comes to coverage under CalCare, you can expect to have, like, of course, your like vision, your dental, your long-term care, any type of like reproductive health services that you might need, any type of like mental health services that you might need. But in addition to that, like any type of like healthcare that you might need that is preventative, that your yearly visits, anything like that, that's all covered. The only thing that's basically not covered under CalCare is any type of like elective type of procedures or anything like that. And I see another question that we have coming up is like, what happens if you go out of state? So when it comes to CalCare, CalCare is the legislation that we're supporting within California to establish a single payer healthcare system in California that covers everybody and that covers all types of essential healthcare that you might be looking for. But nationally, there is a campaign to pass Medicare for all. So if you are from outside of California, but you want to join this fight and you want to be a part of this fight, a great way to do so is to join our Medicare for All campaign. And so if you're interested in learning a little bit more about that, you can go to info@medicareforall.org. And you can email us there and you can get plugged into that national campaign. But for CalCare, this is a California specific campaign.
Great. Thank you so much. And thank you, Sheila, for also bringing that up. That was a good little segue there too. Again, really appreciate it. Again, this is not the last time we'll probably be hearing from these folks, everybody, and you have the information to get involved with the campaigns. Again, I wanted to thank our speakers for joining us this evening, Sheila from DC and Yvette, neighbor in the Bay Area for myself. You all are free to leave. We'll do a couple of wrapping up stuff here, but again, thank you so much. Thank you, thank you, thank you.
Thank you, Eden.
All right, folks, we are back. It's me. I have returned. Want to make sure everyone gets everything that they need for this evening. I hope everyone found this super informative. I know that I know this stuff like the back of my hand, but I really wanted to make sure everyone is able to understand these things and why we're fighting for this stuff. Really appreciate it. I know folks continue to have a lot of questions about these things. This is not the end-all be-all for this stuff. So I really appreciate you joining us, asking questions. We will do our best to get any lingering questions resolved, but I really appreciate you joining us this evening. Last thing I do want to cover is stuff WFP related. Granted, this is, but a couple of things that we have coming up. First things first, we have our California convention coming up. If you have not heard, we are hosting our first ever in-person convention this May, last weekend of May into June. You should be able to sign up still with the early bird link in the chat if the link works. The link is still there. You have till 11:59 p.m. this evening for the early bird registration. We will have guest speakers, there will be music, there will be 3 days of activities, meeting one another. We encourage everyone throughout the Bay Area and wherever you are across the state to join us. It's a little easier for the Bay Area because we are hosting this in San Francisco. But again, really hope that folks are able to join us. It will be a great opportunity to meet us as staff, the other organizers, our steering committee, all of us together in one place. So I hope you're able to join us. And leading up to this, we are also having our campaign camp back. If you were around in the fall of last year, our campaign camp is for folks interested in running their own campaigns, helping out on staffing campaigns, being a volunteer, anything that could utilize campaign information. This is the place for you. All of these trainings are free, 100%. All we ask is that you show up and pay attention. Food, coffee, all of that will be included. So hopefully you can attend. There will be in-person ones as well as virtual sessions for those unavailable to attend in person. But we will have a kickoff on April 29th. The application I dropped in the chat takes about 30 seconds. Pretty easy. We just want to make sure that you are who you say you are when you show up. I want to also make sure folks know who we are. This is not even up to date because we just got another San Diego organizer who joined us. But if you want to get in touch with us as California WFP, this is the link to our link tree in the chat as well. Hope you can attend and come to any of the events that we have coming on in different regions across the state. Myself, I am in the South Bay, but I am the statewide organizer. We have folks up and down the state. Happy to connect with you on ways that you can get involved locally. Again, don't be a stranger. We're all friendly here. We're all excited to build with you and grow with you. If you have questions about this evening, if you have questions about anything WFP related, WFP tangentially related, please let us know. I mean, we're happy to talk to you. We are excited to do all these things. Yes, to the question about WFP in Sacramento, you'll want to connect with Neil Sanapa, who is the senior organizer for Central Valley and Central Coast. Sacramento is included in that. If you do not see your area represented here, you can always reach out to me. I'm the statewide organizer, but I encourage you to get in touch with your local organizer. With that being said, we are ending a little early today, jam-packed with a lot of information. I hope everyone had a fantastic evening. Thank you again for joining us. Hope everyone is staying nice. I see a lot of Bakersfield repping. Shout out to Bakersfield. Again, really hope that you can attend either our convention, our campaign camp, or any of the events that we have coming up in the near future. Always excited to grow and learn from one another. With that being said, thank you, everybody. If you have any remaining thoughts, questions, I will stick around for about a couple minutes, but otherwise, you are free to go into the night. Hopefully you are all, I don't think the weather's been too rainy anywhere, but I hope everyone's staying dry, everyone's staying comfortable. But as always, I will see you on our next statewide event. Thank you, everybody. And I'll stick around for a couple of minutes in case folks have questions.
Thanks, Aiden.
Bye, Aiden. Thank you.
To get in touch with Neil, you will want to check out the link tree that I dropped in the chat. You will be able to reach out to him. I believe his contact information is there. Thank you, everybody. Maddie B, I'm going to take you up on that. Helping out with streaming and Discord and stuff. Help folks on IG were able to listen in and check all this stuff out. I'm sorry if I didn't pay attention to you. I was not able to blend together the chat for YouTube and Instagram. Again, I will stick around for another couple minutes in case folks have any lingering questions. I appreciate everyone who was engaged and involved. Makes things more lively when we're all here and chatting together. All right. It seems that nobody else has any lingering questions. If you want to talk to Neil, he dropped his number in the chat. But thank you again, everybody. Hope everyone has a fantastic evening, and I will see you in the next fight. Take care, everybody.